My name is Pastor Lipava, and today I have joined by a guest who will give us more insights about diarrhea. So we want to talk more about it. So I welcome you, and I decided you to introduce yourself.
Oh, my name is Maria Stima.
Okay, fine. So let's discuss about diarrhea. First of all, I want to know the definition of diarrhea. So what is diarrhea?
Diarrhea means having a loose or waterless stool. It's so common that most people flinch when they hear the word. He thought of thin, sickly, looking poop in the toilet. Bro never stops feeling unpleasant. If you have diarrhea, not knowing that's causing it, or how long it lasts, only adds stress to the unpleasant feelings. The good news is that diarrhea is usually mild and goes away within a few days. Sometimes, though diarrhea is a sign of a serious condition, it can cause you to lose too much fluid or prevent you from getting enough nutrients. It's important to know what to look at for you, so you know when to see a healthcare provider about diarrhea and when to wait it out.
Okay, so what are the types of diarrhea?
There are several types of diarrhea. The first one is acute diarrhea.
Yeah.
Acute diarrhea is loose watery diarrhea that lasts 1 to 2 days. It's most common type and usually goes away without treatment. The second one is persistent diarrhea. Persistent diarrhea lasts about 2 to 4 weeks.
Yeah.
And the third one is chronic diarrhea. Chronic diarrhea lasts more than 4 weeks or comes and goes regularly over a long period. Diarrhea that lasts this long may indicate a more serious condition that warrants a visit with your healthcare provider.
Okay, so how common is diarrhea?
It's incredibly common and affects people of all ages. Most adults get acute diarrhea once a year, while children tend to get it twice a year.
Yeah. Okay, so what causes diarrhea?
The main cause of diarrhea is a virus that affects your gut. Some call it stomach flu. But diarrhea can have lots of causes. Infections, pathogens can all cause infections that lead to diarrhea. The most common cause of diarrhea in adults is the norovirus that causes gastroenteritis.
Yeah.
Norovirus is the most common cause of acute diarrhea in children. Food poisoning, you can ingest harmful toxins and passages from contaminated foods or drinks. Once they are in your gut, the toxic or germs can cause diarrhea. Traveler's diarrhea is when you get diarrhea while you're traveling in a new environment with poor hygiene or sanitation. Usually, it's exposure to bacteria that gives you diarrhea. And medication diarrhea. Diarrhea is a common medication side effect. For example, antibiotics kill harmful bacteria that make you sick, but they can destroy helpful bacteria in the process. Not having enough food bacteria can lead to diarrhea. And diarrhea also a side effect antacids with magnesium, and some cancer drugs and treatments. Overusing laxatives can also cause diarrhea. Food that upset your digestive system. If you are lactose intolerant, you get diarrhea because your body struggles to digest lactose. The sugar in diarrhea. Some people have trouble digesting fructose, a sugar in honey and fruits that's added as a sweetener to some foods. With serious disease, you get diarrhea because your body has trouble breaking down gluten, a protein in wheat. Diseases affecting your bowels. Diarrhea is a common system of condition that causes irritation and inflammation in your bowels. Chronic diseases and worsen symptoms if you have a condition like IBS. Procedures on your bowels. Many people have diarrhea after surgery on their bowels. It may take a while for your digestive tract to absorb nutrients from the foods you are eating and create film stools from the waste.
That's all.
Yes.
Okay, so there are several symptoms of diarrhea. So what are they?
Oh,
Mm.
the main sign of diarrhea is loose or waterless stool. Other common symptoms include bloating or cramps in your bladder, a strong and urgent need to poop. These symptoms usually don't require a provider visit, especially if they are only last a few days.
Okay.
Yes.
So what are the signs and the symptoms of severe diarrhea?
Oh, there are several signs and symptoms of severe diarrhea. Several causes of diarrhea may signal a medical condition like a serious infection that won't get better without treatment from a healthcare provider.
Yeah.
Contact your provider if you have a diarrhea with fever, severe pain, vomiting, blood or mucus in your stool, weight loss, or contact your provider if you are experiencing symptoms of diarrhea or noticing signs of dehydration in your shower, including headache, flashed dry skin, irritability and confusion, severe nausea and vomiting, light headaches and dizziness, fatigue, dark pee, small amounts of pee, fewer than 6 wet diapers a day, no wet diapers or peeing of 8 hours, no tears when crying. Yeah, that's all.
Okay, so what are the complications of diarrhea?
Oh, dehydration is one of the biggest concerns with diarrhea. This is especially true among vulnerable population.
Okay.
I said among vulnerable population, without treatment, dehydration can lead to kidney failure, stroke, heart attack, or even death. Yes.
Okay, so how is diarrhea diagnosed?
Okay. Most cases of diarrhea don't require a diagnosis or treatment. In most several cases, your provider will work to determine the cause. They will ask about your medical history, family medical history, travel history, and any sick contacts you may have. They may order tests including blood test to rule out certain conditions that cause diarrhea, a stool test to check for blood bacteria infection and parasite, a hydrogen breath test to check for lactose or fructose intolerance and bacteria overgrowth, and the endoscope of your upper and lower digestive tract to rule out growth or other structure issues that can cause diarrhea like ulcers or tumors.
Okay, so how is diarrhea treated?
Oh, usually you get diarrhea at home. Although they counter medicine for diarrhea like bismuth, subslicylating, often help people feel better quickly. You will need to see a healthcare provider for diarrhea that doesn't improve or that happens alongside the symptoms of severe diarrhea.
How is diarrhea treated?
Oh, usually you can get rid of diarrhea at home over the counter. Medicine for diarrhea like bismuth, subscribing often help people feel better quickly. You need to see healthcare provider for diarrhea that doesn't improve or that happens alongside symptoms of severe diarrhea. Your provider may recommend treatments like antibiotics or antiparasitics. These drugs kill infection causing germs. Medication that treat chronic condition, treating underlying conditions that cause diarrhea like inflammatory bowel diseases and IBS can help. Probiotics and probiotics introduce good bacteria into your gut to combat diarrhea. Healthcare providers may suggest you to try them. Always talk to your provider before starting a probiotic or any supplement.
Okay, so can I stop diarrhea without taking anti-diarrhea medication?
You can often get rid of acute diarrhea through lifestyle changes you can make at home. Or drink plenty of water and other electrolyte balanced fluids. This includes and pure fruit juices, broths, sports drinks, and caffeine-free sodas. These drinks replace loss of water and electrolytes. You are losing diarrhea.
Yes.
And the electrolytes are substances that help with important process like maintaining the balance of fluids in your body. And you need to choose food that can fuel your stools. Certain low fiber foods make stools more solid. Try the bread diet, and bananas, white rice, and toasty.
Yeah.
Okay. And also in potatoes, needle, leaf beef, fish, chicken, or turkey without the skin are also good options. Changing your diet can make a huge difference when it comes to getting relief. And also avoid the caffeine and alcohol. Foods and drinks can have a mood reductive effect that worsen diarrhea, still clear or cold sodas, strong tea and chocolate. Avoid alcohol, which can lead to dehydration. And also avoid drinks that give you gas. Avoid beans, cabbage, sprouts, beans, and carbonated beverages to prevent stomach cramps. Sometimes diarrhea can make you temporarily lactose intolerant. Avoiding dairy until your diarrhea clears is a good idea.
Okay, so how can I arrive at discomfort caused by diarrhea?
Oh, diarrhea can cause you anus to feel sore, itch, or like it's burning. It may oh okay. It may hurt to poop. You can ease the pain by sitting it lukewarm water in the bathtub or trying this bath and pat your anus dry instead of rubbing it. When you get out of the water, applying Orium jelly or a hemorrhoid cream to your anus can keep it from getting too low.
Okay, so what do I do if my baby or young children has a diarrhea?
Call your child pediatrician. If they have several diarrhea, treatments of diarrhea in children are different from treatments for others. Although the counter medication may be dangerous, children are also at a higher risk of dehydration than others. Your provider will help you to determine the best way to keep them dehydrated, but options include breast milk, formula is like electrolyte drinks for older children. The best option to keep your child dehydrated might change as the child gets older. Always check with a provider before giving your child a new liquid treatment of any kind.
Okay, so can diarrhea be prevented?
You can't always prevent diarrhea, but you can reduce your risk of getting it because of infection or food contamination. Practice food hygiene. Wash your hands with soap and water after using the bathroom or preparing and eating food. Another option is to use hand sanitizer. Get vaccinated or rotavirus vaccine prevents rotavirus, a common cause of diarrhea. The vaccine for COVID-19 can reduce your risk of getting COVID and experiencing COVID symptoms, including diarrhea. And also store food properly at a correct temperatures and cook all foods until they reach the recommended temperature. Don't take chances by consuming foods or drinks past their expiration date.
Okay.
And also you can watch what you drink when you travel. Don't drink untreated water when you travel. Avoid tap water, ice cubes, or brushing your teeth with tap water. Stay clear of pasteurized milk or juice products. Pasteurization is a process that kills germs in certain drinks. When it doubled, drink bottled water or something that's been boiled first. And you also watch what you eat when you travel. Avoid low and undercooked meals, as well as low fruits and vegetables. And also fruits and vegetables are usually healthy options, but the skin may contain contaminants that can make you sick.
Yes,
is that so?
Okay, so when should I call my doctor about diarrhea?
Call your health care provider if you have diarrhea that doesn't improve or go away within a few days. Leash out if you have a fever, several pain, and a bloody stool in addition to diarrhea. See a health care provider if you are expressing symptoms of dehydration which can be serious without treatment.
What is your advice or nutshell to people who are affected or not?
Okay, my advice is that going to the bathroom, having a bowel movement, pooping, no matter what you call it, stool in a regular part of life, that's a big reason why diarrhea is uncomfortable. It messes up your normal. Usually diarrhea is a short-term thing that resolves in a few days. If it doesn't, or if you are experiencing symptoms of severe diarrhea, contact your health care provider and don't be embarrassed. Diarrhea is a common condition your provider knows all about. They can advise you on the best ways to get relief fast.
Okay, fine. Also, this is to mark our discussion for today. So thank you for giving us outstanding information like this, and you were with me in Personal Recover as a host and my friend
Maria Steamer.
Thank you.